What is non-12-step holistic treatment for prescription drug addiction? Well, many of us don't think about prescription drugs as becoming addictive, but if we look at the opioid crisis, a lot of that stuff is prescribed, and there's a lot of lawsuits around the companies that have prescribed them. And so prescription drugs, they often say, don't come off of this abruptly. Don't just stop taking it. If you look at many antidepressants and many anti-anxiety medications, they say you can't come right off of this. That means you're addicted to it. So what we need to do is understand the process of addiction, and in order to do that, I have to understand why I'm taking prescription drugs in the first place. So we might get there from some pain and then become addicted. But we have to ask the question, why does one person take an opiate for pain and not get addicted and the other one does? Well, because the other one likes it and it alleviates, it makes them feel better. It alleviates some stress. It takes the edge off, kind of like having a cocktail at the end of the day. You know, it just makes you feel a little bit better. So I keep doing it and doing it and doing it. So anybody can become addicted to prescription drugs. It's not a reflection of personality, or we don't have to go out on the street. It's none of that. It's just that my body adapts to it and then I need it. And once I start into that behavioral pattern, now I'm going to often compromise my values, compromise the way I look at the world. I might lie a little bit to my doctor. I might start to lie a little bit to my family because I'm ashamed of all of this. And so now I'm in the addictive cycle, even though it started in a very innocent way with a prescription. And so we have to treat this addiction as any addiction and address the underlying root cause. Why do I fall prey to that? So there are some old science that just says, well, you're an addict and you had those genes. Well, I can tell you there is no addict gene. It does get passed down, but they have not isolated one gene that's connected to addiction. They just haven't done that. So people have a propensity that may be handed down in family systems, just like the propensity for many family patterns. So we have to address these conditions, and we have to do that in a holistic way, or else we're just window dressing, or else we're just treating symptoms. And then I'm stuck with a life of symptom management, which means I better go to a meeting, I better do this, I better stay away from that. I'm always wrestling with this thing. I'm not quite, I may not be using, but I'm thinking about it, or thinking about not doing it. It's still occupying space in my mind that I could be devoting to the things that I really care about in my life. So that's why we need a holistic approach so I can heal the root. So in a holistic approach at the sanctuary, we have protocols to heal the body and all the toll that addiction takes on our body, all the toll that stress causes to our body, all the cortisol and the stress hormones that flood our body. We have to heal the body. We have to repair the brain and the damage to the brain and the damage to the psyche. And oftentimes when people fall prey to addiction, they have some underlying unresolved traumas that they don't even know about. And things that are so buried deep in the psyche because we protect our wounds. These are things that are often buried so far in the psyche that, you know, I had a trauma that happened when I was in first grade that I didn't remember until 2 or 3 years ago. And so we've got to repair the brain. And next, we have to recover the soul. So what that means is this place, and think about your heart, you know, the place where you have purpose and meaning and your truth and who you really are. And those are the things that we lose to any addiction, whether we got it from a doctor or we got it on the street. And when we use a very integrated, non-12-step holistic protocol that fits together, just like all the systems in the body fit together in a very precise, integrated way, our program components fit together in a precise, integrated way. Because, you know, we found, and a lot of centers right now are using an old antiquated treatment model and just throw in some holistic processes in there, which is great. They're on the right track, but they're also disintegrated. Most of the people that are watching this video have access to doctors and healers and, all counselors and therapists and all those kinds of things, and I've been to them all. Why can't they get traction? Because it's not integrated. And that's what we do here at the Sanctuary better than anybody that we're aware of.